Okay, so this is left ear tympanoplasty, as I explained. We have the incus there, the stapes head, okay, the stapes tendon, and the fallopian canal here, and the stapedial tendon, the pyramidal process. This is my exposure, and we have here this fibrous adherence between the eroded incus that we can see here and the stapes head. This explains, of course, the airborne gap. And as I said, we can use cement to rebuild this incus stapedial joint, but I always prefer, but this is a personal view, I always prefer using reconstruction with a TORP in this case. So I will use, of course, the silastic bending technique. So first I just want to cut this fibrous tissue here, and then we'll be okay. Ciseaux. Ciseaux. Okay, all is fine now, and I will, of course, check the ossicular chain mobility, but especially the stapes. But it seems to be perfectly mobile, as we can see. Checking it from the top of the head, and you see the mobility of the stapes is clear. You can see also the full plate mobile. So everything is clear. We have a very nice exposure here. So now what I'm going to do, I will dissect the malleus handle because I want to do the malleus relocation again. So the first step here, tableau en avant, would be to separate the malleus from the tympanic membrane. Stop. Okay, I think we have a good exposure here. We cannot see the chordae tympani, which probably was cut during the previous operation. So this is the malleus handle, and because it's a revision tympanoplasty, and the previous surgeon was doing only a meringoplasty. But there is, as you know, atrophic tympanic membrane, so we need to do a reinforcement of the tympanic membrane. So I already took this perichondrium graft from the external side face of the tragus. Je vais prendre le normal là maintenant, je pense. So we are now at the level of the elbow, which is always more tricky to dissect. C'est un aspirateur de combien que j'ai là? Combien? D'accord. I'm following now the bone of the elbow. And you know that at the moment the incus is still there. I will remove it later, because it helps me to stabilize a little bit the malleus when I'm dissecting the malleus like this. And of course I will insert my graft between the tympanic membrane and the malleus handle, because that's the technique I'm using always. Okay, nearly done. I think I have some residual attachment here. Okay, it should be okay. I'm going to check the tympanic membrane, but I think it's fine. Yes, it's good. Clear. Okay. Okay. Alright, so now I will remove the incus. You can see that the whole malleus is separated, the entire malleus is separated from the tympanic membrane. So now I can remove the incus. And the next step will be to cut the tympanic tendon. Donnez-moi la pince. I have to pull the incus a little bit to remove it. Okay, crochet à os. Alors, donnez-moi un autre aspirateur parce que là, j'arrive pas du tout à aspirer avec. Hein. Ok. Voilà, c'est mieux. There we go. Manque de puissance d'aspi là, je sais pas pourquoi, mais très faible. Okay. Bon, okay. Alright, so now what I'm going to do is I'm going to cut the tympanic tendon. Lancez-vous les directs. And then I will overstretch the anterior tympanomallear ligament. Crucial. So you see the gap that we have between the malleus and stapes head. So I don't want to have to bend the prosthesis, and I want to use the malleus, so I will grab the malleus like this. I like to put my circle on the other side, it helps me to control the malleus mobilization here, like this. There we go, and now I think it's ready to be placed over the stapes head, so we change completely the position. And now we have a vertical final position of everything at the end. What I will do now, I will measure the distance and then I will put the graft at the end, crocheos. So we need to stick the malleus back to the tympanic membrane, like this, before measuring. Because in fact, there is a tendency to see the malleus medialized, like in this case. So we need to, if I want to measure perfectly, I need to stick it like this, okay? And then I can measure from the relocated malleus handle to the stapes footplate. Using an elongated stapes measuring rod, which is using several notches, 5, 6, 7, and 8 millimeter long. So I'm touching the footplate in the deep, and we'll see that the second notch is in front of the malleus, which means 6, and I always add 6 millimeters, so it will be 6.5. Now, before placing the prosthesis, I will put the graft. Pardon, s'il vous plaît. Elle marche pas. Oui. So we have a problem with the suction system. It's not a very large canal, as you can see, but we have enough gap for that. Okay. Okay, so now I'm going to place the graft, which I took. So this is a perichondrium graft. Calmez s'il vous plaît d'abord. Calmez. So it needs to go over the malleus handle to cover the posterior half of the tympanic membrane. So this is the perichondrium graft, which is pretty good, quite big. In fact, in my experience, the graft that we take from the lateral side of the tragus is always larger than the one from the medial side. Okay, can we? All right. So first step is to place the graft and drive the graft carefully over the malleus handle. And you see it's pretty narrow because when we put everything together it's not easy to see anything else. So I have to stretch the graft step by step. It needs to be over the malleus handle, which is not the case here, so that's different. The malleus handle is there. Oh, je peux pas attraper la griffe. So I try to stretch it. Ah, ça aspire pas, hein. Malleus handle is there. Okay, let's try to move the malleus back more posterior like this. So then I will be able to place the graft more easily. I hope. But it's very narrow, as you see. There we go. Now I think it's fine. I'm covering the even a little bit of the anterior part of the tympanic membrane, but the most important one is the posterior anterior part of the drum, because this is the part where the tympanic membrane was clearly atrophic. And of course I want to stretch the graft over the bony canal wall here, and I think it's done. So I will reposition the whole flap like this first, and then re-elevate the whole thing, the whole flap plus the graft, and then place the TORP at the end. Bon, alors table vers moi maintenant. Okay, so we're going to move the table, and I will now insert the prosthesis. Stop. I think I need to enlarge the bony membrane section to have a better access to the stapes tendon. Donnez-moi la curette, s'il vous plaît. So I need to, you see we have some kind of exostosis here. So this is something that was going to be better if I remove it, because I will have a better exposure of this posterior part of the stapes tendon. Okay, I think it's slightly better now, and of course I need a little bit of more gap to introduce the prosthesis, and especially, of course, the prosthesis head. Okay, all is fine now. Alors, ciseaux. So the next step is to prepare the silastic bending technique. So I will cut the tendon as long as possible. Coupe rien faire. I have to change the micro scissor. There we go. Okay, and now I'm going to place the TORP. Causse Ear, s'il vous plaît. So the malleus handle is there, and now we need to place the TORP. Okay. All right. 6,650. J'ai dit 6.5 then. Okay. So this is the HA-Titanium TORP. So I want 6.5 like this. So I put at 5.5 first. Then cut the proximal part of the shaft and then pull it back at 6.5. Like this. And now we have a 6.5 millimeter long prosthesis with the bend in the middle. So we're going to use the bend to attach the prosthesis to the stapes, of course, as usual. S'il vous plaît. I like to push a little bit the bend, which is too high. So pull it a little bit like this. Yeah, I think this should be okay. All right. So what we need to do now is to first, insert the prosthesis. The aim is to place first the distal tip of the shaft to the full plane. Alright, so it's pretty narrow here, so I need to introduce the head like this and introduce the distal tip like this. Okay, I think it looks fine. Now what I like to do is to rotate the prosthesis and insert the malleus handle temporarily within the groove. Like this. Alors, crochet os. So I need to hold the prosthesis with the sucker and then pull the malleus like this. Okay, and then it should go down. The malleus should go down into the groove. There we go. We have a little bit of titanium in contact with the malleus, but it's not a problem, of course. Okay, I think it looks pretty good. And what I need to do now is to attach the prosthesis to the stapes with the bend. So of course this will dislocate temporarily the prosthesis from the other window, but I need to place it on the other side, and I will then reposition the prosthesis after that. So there we go. Calmez s'il vous plaît. Try to place it on the other side of the stapes head like this, and now it needs to go below the stapes tendon. There we go. Okay, and now you see the difference is very interesting. Now they are definitely connected tight, but not too tight, and it's over the stapes tendon, but it's pretty stable there. And if I move the prosthesis, the point is that they are really moving together, just like a single unit, which is the point. And the second point is the final vertical position of the prosthesis, and also the fact that I'm using the malleus handle. You see the malleus handle is still within the groove, means that we have 2 points of stability, one with the malleus handle and one with the stapes superstructure with the bend. Okay, so I think it's fine, and that's good. All right. I always re-elevate a little bit the flap and to see if the prosthesis stays in place, because the trick, if by chance you put a too long prosthesis, when you do this, when you re-elevate the flap, then you can see that the prosthesis is falling backwards. So this means that it's too long. Okay, fine. All right. So we need now to place the mirror cell. Allez-y. Okay, very good. Thank you.